acting medical surveillance officer. The Ministry of Health, Wellness and Elderly Affairs is aware of a rising number of reported cases of hand, foot and mouth disease in some preschools and kindergartens across the island. We are working closely with these institutions to address the situation and to ensure the safety and well-being of children, staff and their families. Hand, foot and mouth disease is a highly contagious viral infection primarily affecting young children, particularly those under the age of 5 years. It is caused by viruses from the enterovirus family, most commonly the Coxsackie virus. The disease is typically mild but can cause discomfort and inconvenience for affected children and their caregivers. The key symptoms of hand, foot and mouth disease include fever, sore throat, fatigue and general malaise, painful red spots or sores in the mouth, on the tongue, and inside the cheeks. Rash or red spots on the palms of the hands, soles of the feet and sometimes the buttocks, and loss of appetite. Symptoms usually appear 3 to 6 days after exposure to the virus and can last 7 to 10 days. While most children recover without medical complications, parents and guardians should be vigilant about these symptoms. Children under 5 years old are the most susceptible to hand, foot and mouth disease because their immune systems are still developing. The close contact in settings like preschools and kindergartens, where children frequently share toys, utensils, and spaces, creates an environment where viruses can easily spread. Additionally, young children are more likely to put their hands and objects into their mouths, increasing the risk of infection. Though hand, foot and mouth disease is typically mild, in rare cases, complications can arise. These complications may include dehydration, especially if painful mouth sores prevent drinking of fluids, viral meningitis, an inflammation of the membranes surrounding the brain and spinal cord, and encephalitis, a more serious brain infection. It is crucial to monitor children closely and seek medical advice if symptoms worsen or if the child shows signs of severe illness, such as persistent high fever or unusual drowsiness. There is no specific treatment for hand, foot and mouth disease. However, supportive care can help relieve symptoms and keep the child comfortable. This includes offering plenty of fluids to prevent dehydration, providing over-the-counter pain relievers or fever reducers such as ibuprofen or paracetamol, and ensuring adequate rest and avoiding spicy or acidic foods that may irritate mouth sores. The most effective way to prevent the spread of hand, foot and mouth disease is through good hygiene practices. We urge all schools, parents and caregivers to implement the following measures. 1. Hand washing. Ensure that children and staff wash their hands frequently with soap and water, especially after using the bathroom, changing diapers, or handling food. 2. Cleaning and disinfecting. Schools should regularly clean and disinfect surfaces and objects that are commonly touched, such as toys, door handles, and tables. 3. Isolation of affected children. Children with symptoms of hand, foot, and mouth disease should be kept at home until they are no longer contagious, usually about 7 to 10 days. 4. Coughing and sneezing etiquette. Teach children to cover their mouths and noses when coughing or sneezing, using a tissue or the elbow, and to dispose of tissues properly. The Ministry of Health remains vigilant and encourages the public to remain informed and to continue practicing good hygiene. If you suspect your child has hand, foot, and mouth disease, or if they develop concerning symptoms, please consult your healthcare provider. The Ministry of Health will continue to provide updates to the public on this situation.